Kratom is derived from the leaves of the kratom tree and has been used in Thailand, Malaysia, and elsewhere for hundreds of years, where it's been used to relieve pain, fatigue, and in this country, America, even to produce a legal high. Kratom can act as both a stimulant and as a depressant, depending on how much you take. While kratom remains popular, there's another side of the story you need to hear about. Let's look at some of the deaths associated with kratom use. In 2014, it was reported on the death of a 36-year-old man, where his death certificate reported his death to be associated with mitragynine toxicity, mitragynine being one of the compounds in kratom. In 2017, the Associated Press reported on the death of a 27-year-old police officer who died while taking kratom. The only substance in his body that was found was a high level of kratom. That same year, newspapers reported on the passing of a 25-year-old apparently healthy man. According to reports, his death was said to be due to mitragynine intoxication. In 2018, a Florida man appears to have passed due to mitragynine toxicity, although it was also reported some alcohol was also found in his system. And that is a point that needs to be made about some of the deaths. In many of these cases, people were taking other medications or drugs along with kratom, which makes it somewhat difficult to figure out what the actual cause of death was due to. When researchers searched reports of the National Poison Control System, they found 2,312 reports of people reporting health problems from kratom use. Of those cases, 935 cases, about 40% of them, kratom was the only substance reported being used. In 2019, a paper was issued by the Centers of Disease Control where they analyzed over 27,000 cases of overdose and found 152 cases, about 0.5% of those cases, people tested positive for kratom. Now, of those 152 cases, kratom was found to be a cause of death for about 60% of those individuals. The FDA posted a news release where they stated there had been at least 44 deaths associated with people using kratom. So nobody is comparing kratom overdose to the even larger number of people who've died from opioid abuse. That said, kratom is not a dietary supplement. Even though you can buy it over the counter, it's not a dietary supplement. And it continues to be a controversial drug that people need to be aware of. And that includes parents also. If you believe kratom is safe, what you need to do is pressure elected officials to fund the right kind of clinical research. Do not accept studies on mice and rats. They're not the same thing as people. At the very least, you need to have a safe product and proper dosing instructions. Until next time, I'm Joe from SupplementClarity.com. Take care.